So my name is Greg LaFrancois. I'm the president here at St. Joseph Hospital, and I'm absolutely thrilled that the governor has come to join us today to shed a light on an incredibly important program that Senator Dusan had really fought the good fight to bring to fruition for us. And this provides the resources for the forensic nursing program that we operate here at St. Joseph to have access to the rape kit tracking, which is incredibly important, and it sounds easy, but it's not, and it's a hard battle to fight. So I'm grateful that you've joined us, Governor, but also I am grateful for your advocacy and all the hard work to get us to this point today. And Carly, I think I'll hand it off to you. Thank
you. Good morning, everyone, and thank you for being here. My name is Carly Fisher, and I'm the Public Policy Director at the Maine Coalition Against Sexual Assault, or MICASA. Today is the culmination of years of work, collaboration, persistence, and relationship building across Maine. A statewide sexual assault kit tracking system did not happen overnight. It's been a long time coming, and there are many people in this room, and many not in this room, who helped move this work forward step by step over many years. At MICASA, we've been working alongside survivors, advocates, healthcare providers, law enforcement agencies, prosecutors, forensic nurses, policymakers, and the crime lab for decades to strengthen Maine's response to sexual violence and to improve how sexual assault kits are handled and stored. But for years, conversations about tracking were particularly difficult. People cared deeply about the issue, but there were real challenges around infrastructure, funding, logistics, staffing, and coordination between complex systems with different perspectives. This work required us to build trust across disciplines and a willingness to sit at tables at the same time, even when conversations were complicated. But over the last 3 years, MICASA and the Maine State Police Crime Lab have piloted a kit tracking system and inventory project in 2 counties here in Maine. During that time, many of us started to feel the tide shift, and the momentum for tracking became real. Instead of asking whether Maine should modernize kit tracking, the conversation became how to do that together and how to do it well. That shift happened because of sustained collaboration. We had survivors and advocates continuing to push for transparency and accountability. We had healthcare providers committed to improving patient care and internal processes. We had law enforcement leaders and the crime lab engaging thoughtfully and constructively. And we had an extraordinary group of legislators who understand that survivor dignity, public trust in the criminal justice system, and strengthening Maine's response to sexual violence statewide are worth fighting for. There have been several bills focused on tracking, but this initiative in particular focuses on survivor autonomy and making sure they have control over every step of the process. And we thank Senator Dusan for that, who originally sponsored the bill that created the language included in this part of Governor Mills's budget. Legislators like Senator Dusan, Representative Holly Stover, worked collaboratively and persistently to move this issue forward, and Governor Janet Mills ultimately helped ensure that this effort made it over the finish line. In her final term as governor, we are extraordinarily grateful that she chose to prioritize this issue. The system will have a lasting impact on survivors across Maine for many years, and I believe it will be a meaningful part of her legacy. Thank you, Governor. A tracking system matters because survivors deserve transparency, information, and clarity about what happens after a forensic exam. They should not be left wondering where their kit is or what will happen next. This system will help provide clarity during a process that can otherwise feel confusing and isolating. It will strengthen accountability across agencies, improve communication, and reduce the risk of kits being mishandled or forgotten. It will tell survivors that their experience, their evidence, and their choices matter. Survivors are more likely to engage with systems when they believe those systems will handle their evidence carefully, respectfully, and transparently. I also want to finally acknowledge that implementation work is still ahead of us. Building a statewide system across hospitals, law enforcement agencies, and other partners is significant work, and many people will continue putting in countless hours to make sure this rollout is thoughtful and effective. But today is an important milestone, and it's one worth celebrating. It's a privilege to do this good work with all of you, and thank you for your partnership. Governor Mills, I'll hand it over to you.
Well, thank you. Thank you, Carly, and oops. This is indeed a project that's been a long time coming. And I want to thank Assistant Majority Leader Jill Dusan And Holly Stover, who's a distinguished member of the Appropriations Committee, very important to get these things through. And Nurse Carrie Capaldo is here. Right here. There you are. Sorry. Thank you. And for joining me here today to mark an important moment for survivors of sexual violence in the state of Maine. Look, 1 in 5 Maine people will experience sexual assault at some point in their lifetime. Every year, more than 19,000 Maine people, it's estimated, are sexually assaulted. 19,000. That's an unconscionable violation of people's safety, security, and bodily autonomy. For 15 years as district attorney for 3 counties in western Maine, it was my responsibility to investigate and prosecute hundreds and hundreds of cases of sexual assault, many of them involving women and children who bravely offered testimony against an offender. And when that testimony resulted in a conviction, as it most often did, we succeeded in preventing that particular survivor from being re-victimized, and we very likely prevented that offender from victimizing others. That's critical, to know that this is not just a one-off offense, as violent as it may be, that this person may have offended other people, may have taken advantage of other people as well. In one such case, a woman I'll call Jane was kidnapped from her workplace by her husband and held captive and sexually assaulted. We got her release, we prosecuted him. She bravely testified and we got a conviction and a sentence of 25 years. But that wasn't enough to make her feel secure. She didn't feel safe even then, and she felt forced to leave the state for many years, leaving her family, her community, her work. She was traumatized. And that's what sexual violence can do. Separate you from your loved ones, your home, your community, make you feel isolated and vulnerable for years afterwards. Like all of you in this room, I am determined to make sure that the state of Maine and state law provides the strongest possible protection against sexual assault and the clearest pathways for survivors and law enforcement to hold perpetrators accountable for these crimes. I am proud to say that since I've taken office, we've mobilized state government to better serve survivors. We've enacted laws to clarify the definition of consent, so there's absolutely no ambiguity when it comes to sexual assault. We enacted laws to expand sexual assault awareness education in our high schools. We have strengthened our response to sexual assault within our armed services, the National Guard, and we've bolstered funding for sexual assault services so that every survivor can get help. 1-800 lines and on-the-spot support services. We've also trained more than 160 nurses like Carrie to treat survivors of sexual assault through the Sexual Assault Forensic Examiner, or SAFE program. In the last 3 years alone, 160 nurses trained. And that's an important thing, because we also made it admissible in court. You didn't have to wait and call a doctor, as we used to have to do. And the survivor would be sitting in an emergency room for hours on end, waiting for a physician to do an exam. Now, a properly trained forensic nurse can do that exam, and it will be admitted in court. So, 3 years ago, my administration began working with MECASA to create a pilot program in Kennebec County and Penobscot County using a federal grant with a goal of implementing a statewide tracking system for sexual assault forensic kits. The pilot program for Penobscot County was located here in St. Joseph's. For 18 months, MECASA, St. Joseph's, and the Bangor Police Department researched the best tracking systems nationwide. And they tested an effective tracking system that put survivors first. Thanks to that coordinated work, as well as new state funding enacted under my administration, we can now establish a statewide tracking system based on our research and support survivors across the state. And then this year, I proposed, and the legislature approved, using $267,000 annually from the general fund to support Senator Jill Dewson's bill, LD 1816, to establish and maintain this tracking system for all forensic assault examination kits. That discussion began last September, October, putting your bill in the supplemental budget, and that's what we did. One service provider described the importance of a sexual assault examination kit tracking system this way. Quote, survivors experience so much loss of control over their bodies during a sexual assault. This continues when they seek medical help and treatment, and knowing where their evidence is going, if it will be tested and where it will be stored, can help to reinstate some of the control that survivors feel they have over their bodies and over the entire evidence collection process. Pretty significant. Well, thank you, Senator Dusen and Representative Stover, and thank you to the sexual assault service providers, hospitals, law enforcement departments, and the State Crime Lab, of course, for working to address the insidious issue of sexual violence and assault in Maine. It was my honor to sign a budget that builds on the work we've done together since I became governor, as well as my own experiences within the criminal justice system going back decades, to deter violence, to protect victims of all crimes, and to help people like Jane heal from the harm and return to the safety of their own home. So, thank you.
Good afternoon. Thank you, Governor Mills. My name is Jill Dusen. I serve as a Senate Assistant Majority Leader, and I'm honored to represent Senate District 27, which is part of Portland and part of Westbrook. As the Governor mentioned, Maine has an unknown number of untested sexual assault forensic examination kits. All of us standing up here agree that just one unaccounted test is too many when we're talking about such personal and impactful evidence. That's why this session I was honored and happy to serve as the Senate sponsor of LD 1816, collaborating with MICASA, the Governor's Office, the Honorable Representative Holly Stover, and she's also the bill's lead sponsor in the House, and a statewide coalition of advocates. This effort was the result of years of work by the incredible group of people alongside me and out there. Last fall, I was absolutely thrilled to learn that the Governor included this crucial piece of legislation in her budget proposal. This has been a work years in the making by many, many advocates. Knowing that my bill not only had her support, but was also being actively prioritized in the budget was incredibly gratifying. This demonstrates a commitment to addressing this critical issue, and I'm grateful to see the positive impact it will have in our community. Thank you, Governor, for your dedication and leadership. From survivor advocates, healthcare providers, state and local law enforcement, and members of the criminal legal system, this coalition led from a survivor-centered approach, and I'm proud to be a small part of that team that got this initiative over the finish line. It is my sincere hope that this new law will make a difference for survivors and encourage them to come forward. Through this budget, we're sending a message to survivors across Maine that we see you, we hear you, and we trust you to seek justice how you choose in accordance with the law. I'd like to turn it over now to my good friend and lead co-sponsor of the new law, Representative Holly Stover of Booth Bay, to say a few words about her role in securing funding for this crucial new program.
Thank you, Senator.
Now, those are two tough acts to follow, I want to say. So today I want to speak about leadership, real leadership, grounded in action, integrity, and a deep, enduring commitment to protecting survivors of sexual assault. Over the course of her extraordinary public career, which I've had the pleasure of serving alongside in many ways, Governor Mills has demonstrated exactly that kind of leadership. Long before she became governor, she built a record defined not only by rhetoric, but by results, especially when it comes to safeguarding the safety, dignity, and equal treatment of women under the law. Her work has consistently focused on strengthening legal protections for survivors expanding access to critical services, and ensuring that our justice system responds with seriousness, accountability, and compassion. That leadership did not stop when she took office. It has only continued. A recent example of this commitment is her support for LD 1816, legislation sponsored and led by my friend, Senator Jill Doosan. This bill did not emerge overnight. It represents years of coordinated work between the legislature and the executive branch to ensure that survivors have the resources they need and that our systems function more effectively and responsibly. Senator Doosan's leadership in advancing this bill was essential. She brought vision, persistence, and a deep understanding of the challenges survivors face. Together, these efforts reflected a shared commitment to doing the hard, often unseen work required to make meaningful change happen. I was proud to serve as the lead co-sponsor of this legislation and as a member of the legislature's Appropriations and Financial Affairs Committee, which allowed me a front row seat to the budget negotiations that ultimately secured this funding. Those negotiations were careful, deliberate, and transparent. The result, a supplemental budget that included funding for LD 1816, passed with unanimous support. That outcome was not accidental. It was the direct result of Governor Mills' leadership and her long-standing commitment to survivors. This funding was the product of sustained efforts, collaboration, and leadership from Governor Mills to Senator Doosan to Mikasa, from other legislators, and most of all, survivors who worked carefully and responsibly within our established processes. And on an issue as serious as protecting victims and survivors of sexual assault, accuracy matters, and integrity matters even more. Governor Mills' record speaks for itself. She has approached this work with seriousness, respect for the rule of the law, and an unwavering commitment to those who often go unheard. Thank you, Governor Mills. Thank you, Senator Doosan, and especially to all the survivors here and out there that hear this message today. You provided the vision and the leadership and the results that led to LD 1816 and the protection it provides. This is the result of thoughtful, determined public service. And that, my friends, is what leadership looks like. And that is what victims and survivors of Maine deserve. Thank you.
Thank you.
Hi, everyone. I'm Carrie Capaldo, and I am the now former Safe Program Coordinator. My replacement's here behind me, Katie Roberts. But I wanted to talk a little bit today about what this tracking system actually means. So this work has never just been about this tracking kit, bill, it's been about what happens to survivors after an assault, whether the systems that they encounter afterward make them feel supported and informed and respected. More importantly, it's about what a survivor needs and expects of the systems responding to them. I've been involved in this work for 12 years, and I've been working towards this legislation for about 5. I've learned that meaningful change like this only happens through collaboration. I want to thank the many people who helped move this forward: survivors, advocates, forensic nurses, healthcare systems, legislators, law enforcement agencies, prosecutors, the crime lab, and many community partners across Maine. This truly was a statewide effort. As a safe nurse, I often meet patients on what may be one of the hardest days of their life. People often think our role is just evidence collection, but it's much more than that. We provide medical care. We explain and educate a range of options to a survivor. We connect patients with advocacy and resources and help them make informed decisions about what comes next. When a survivor chooses to have evidence collected, that decision takes trust and courage. Being able to tell them there is now a system that provides transparency and accountability is a substantial and meaningful change. Survivors deserve to know where their kit is, what happens next, and that their decisions are being taken seriously. I also want to recognize the advocates and safe nurses across Maine who do this work every day. often with limited resources and coverage gaps, especially in rural communities. Systems like this only work if survivors can actually access specially trained forensic nurses and advocacy services when and where they need them. We need every hospital in Maine to continue stepping up and investing in safe nurses so survivors in every community have access to specialized, competent, trauma-informed care. We need more nurses to become safes and community members to become advocates. The systems only work when the people within them are willing to show up for survivors every day in meaningful and trauma-informed ways. Thank you.
Okay, so I wanted to just quickly thank everyone. This is obviously a team effort, and you can see it was not easy. 5 years, I didn't realize that this had been under work. That is just incredible, and it takes incredible endurance. So thank you very much, Governor. We really do appreciate your leadership. And I would just close by thanking everybody for joining us at St. Joseph. We take our commitment to the community very, very seriously. And we do have an event that we run coming up in September, Commit to the Community, which funds the great work that occurs here with our SAFE program. And so we hope we see everybody there as well. Thank you.
And so at this point in the event, we're going to have Katie Roberts behind me, who's the new SAFE program coordinator here at St. Joe's, do a demonstration of how a sexual assault kit is collected for the patients. We'll also be available for questions if anyone has questions. So we'll start with Katie and then we'll be available to you.
Sure. And the kit is over here,
Yeah,
so I'm
it
going to
is.
Yes. Hi, everybody.
It's still the case that the examination, forensic examination is paid for by the state.
Yes.
No survivor, no victim should think that they might have to pay for this.
Yes, thank you. That's a great point, Governor Mills. Yes, as Carrie mentioned, I'm taking over her role as the Assistant Nurse Manager and Program Coordinator of the SAFE program here at St. Joe's. And I have for you today the sex crimes kit that we utilize if a patient so chooses that they would like to have evidence collected. We are specially trained to be able to do so in a trauma-informed way. We have the opportunity to obtain all different types of swabs. It is really an a la carte experience. If someone would like one swab and not another, they certainly get that choice to choose. There's no right or wrong. It's what is best for them, what they feel is best for themselves with the education that we provide around it. It's our basic cotton tip swabs that we can utilize for various things, and we guide somebody through each step of the process, allowing them the option to choose what they do and don't want. We have the opportunity to obtain blood and urine specimens, potentially for any drug-facilitated sexual violence. And like Governor Mills said, we utilize the Maine Victims Compensation Fund if somebody does choose to have evidence collection. And again, it's a great snapshot in time of somebody's body, so that maybe they have the choice of reporting at that time or not reporting at that time. This kit also provides somebody an opportunity, if they're still unsure, to have an unreported kit. So we're able to get that snapshot of somebody's body, submit it to law enforcement. They can still track that kit where it's at as well. And if they so choose later on down the road, the statute is 20 years, this kit will always be available for them within that time frame, so that's a really great opportunity. So really the entire process is about what the survivor wants, and what, like I said, there's no right or wrong, it's what's best for them.
Is this now a standardized test kit?
It is.
Across the state?
It is, yes.
Because in years past, different hospitals, different crime, different people use different kits, right?
Yes.
So this is admissible in evidence.
Yes.
And your testimony is admissible in evidence, and it's standardized. Thank you.
Yes, and like Carrie mentioned, a lot of times people think an assessment for a sexual assault is really just about evidence collection, but really it's a tool that we have as well as, it's a part of their care. It's a tool that we have, and if they do choose to use it, we're specially trained so that we can provide that service for them. So it's a great option to again bring control back to the survivor. We have a multitude of swabs for all different areas of the body, and we have the ability to obtain clothing, like I said, urine, blood, various specimens, so it really gives us a wide range and lots of choice.
Great, thank you.
Yeah.
Thank you, Ann.
You're
Any
welcome.
questions or concerns? Questions from anybody for anybody?
This is probably a question for either Katie or Carrie, perhaps. Since the tracking has been used here in your county, and I know St. Joseph, at least at one point, was the hospital that collected the most number of safe kits in our state, have you gotten any feedback from survivors in the emergency room or after the fact for follow-up care about whether they've been using the system or how they feel when they learn about the fact that they have that option?
Carrie?
What's in the DA's office?
So, something that has always been kind of a little bit of like a moral distressor in forensic nursing is that we can do a lot for somebody in those four walls, and then after they leave, we don't actually have much contact with those survivors after they're gone. Advocacy actually might have more contact in regards to maybe questions about the kit tracking, if any, but we have not had anybody make contact with us specifically about how to utilize it, but they do go out the door with really elaborate discharge instructions. They have their kit tracking number, how to access the tracking system and see where their kit is. I will say that prior to the kit tracking system, we would have people calling and asking questions about the location of their kit or what their kit number was and where it may be in the process. And since the kit tracking system, we don't get those phone calls anymore. So I would, I guess the lack of people reaching out may be evidence that it's working and that people are accessing that information on their own.
And folks are provided with these cards as well. When they leave, they have their kit number. They're able to utilize the QR code to track their kit in real time.
That's great.
Yeah, really
Great.
great program.
You guys said that there's still implementation to be done. What are the next steps that we're going to be seeing here?
Coordinating 160 law enforcement agencies.
You got it. So any project of this magnitude across so many systems is going to have a lot of complexity in training folks and onboarding them and really developing a clear and efficient pathway to get everyone on board. And so since MICASA has been holding this project since 2023 when the research project began, we're going to be working on now actively to transition leadership of this project over to the Maine State Police Crime Lab. So right now we're sort of in that transition phase of the project management and planning phase for what it looks like to transfer that leadership, but also to plan for a step-by-step rollout of statewide implementation. And so the crime lab is still waiting for that money to come through because money doesn't sort of fall into their laps right away after the budget process. But one of their first steps is going to be to hire someone who can come in and oversee administration of this system. So right now we're working on a statewide implementation plan and we're working to teach them and train them. But we're waiting for that person to come on board who will ultimately be leading this ship. And yes, to Governor Mills's point, it's a lot of cats to herd, but we're excited.
And ultimately, cure any backlogs anywhere.
Yes.
And get every appropriate kit tested. And working with the DA's offices, we know that they prioritize active cases now. But now, hopefully, they can also track the DNA of offenders who may not have been identified in the past in other cases. That's critical.
That's right.
Anything else? Well, great.
Sorry,
Oh,
actually,
sure.
one question for Governor Mills. Thank you all so much for being here and for the demonstration and everything. This is really great to see actually how it all works. Governor Mills, I have a question for you about another critical issue related to sexual health, just the HIV outbreak here in Penobscot County.
Oh, my.
It's been going on for a few years now. We reached 43 cases last month.
I saw that.
Yeah, so
Yeah.
definitely still ongoing. I'm curious kind of what your reasoning is why you haven't declared a state of emergency or kind of what you see as the next steps.
Well, we have assigned more public health nurses to this area for the very, very purpose of testing. We've been doing that the last year, more than a year, for the purpose of testing and providing treatment for people and making sure that they don't infect somebody else, providing the proper counseling and that kind of thing. So we are trying to address it. People, we can't force them. This is voluntary treatment situation, but hopefully they'll acknowledge the risk. And testing is what results in public awareness. It's not appropriate at this time to declare a statewide state of emergency for that purpose, because that wouldn't accomplish anything more than what we're already doing and what the Bangor public health people are doing. Excellent work on their part to try to address this. Thank you.
In addition to what Governor Mills was saying as well, as part of our care for the sexual assault patient, we also do a risk stratification process, seeing whether or not somebody's appropriate for NPAP or post-exposure prophylaxis for HIV, and we also provide that to folks as well. So that's a big part of what we do. Like I said, evidence collection is a really important part of a survivor's choice. But again, we also offer a lot of other things: STI, HIV prophylaxis, pregnancy prophylaxis, and a lot of things to help take care of the whole person.
We also have access to a rapid HIV test that we can give out to people.
Wow.
And we do hand those out.
Good one.
Yep.
One more question, just to return to the kit tracking. Governor Mills, this one is for you, since you've mentioned the next step, which could be down the road, potentially testing. And I know that anonymous, unreported kits can't be tested at this point. As you mentioned, prioritizing current cases. So when you talk about expanding that to test some of the backlog, there's no requirement. Will those decisions just be made at the DA level, or how do you anticipate this moving forward?
Those decisions will be made in collaboration with the local district attorneys, 8 of them. They have some wherewithal to prioritize, which they're doing now. And I don't want anybody to think that if they're assaulted today and go through an forensic examination, that they won't be able to go to court or they won't be able to bring their case because of a current backlog. That's not the case. Active cases are currently prioritized by everybody in the system, including the investigators, police, and prosecutors. It's the cases where there hasn't been a kit tested, let's say where the offender is known and maybe that person pleads guilty without going through a trial or even a full investigation. Then that kit may just lie in storage for a while. But that offender may have assaulted other people. So it would be important to obtain that DNA, fulfill the testing requirements, and to see if there are other cases out there that we have not addressed. So that's the kind of backlog we're talking about.
So in terms of the decision which kits to test, that'll just be a conversation between DAs and the local police departments once inventory is complete?
I know some advocates nationally promote mandatory testing. I don't think we're there yet. I don't know. That'll be a conversation, but as far as I can tell, the fact that a kit is tested has to do with the survivor's wishes and the need for prosecution, the need for investigative evidence, and that kind of thing, and the prosecutor's viewpoint as well. That's my understanding, is how that will go. But I stopped by a police department a little ways from here last week just to say hello, and they showed me their evidence room, and they had a pile of test kits in storage, probably a dozen of them or so. And I thought, wow, okay, we're going to get those taken care of. Inventory first, and again, there are 160 different law enforcement agencies in Maine. Inventoried, as we've been doing, and labeled, identified in a statewide database, and using the proper software to track them and to provide the online portal for survivors to see where they're at as well. So it sounds easy to just provide funding and do something about this, but it's a lot more complicated than it seems at first blush. We're getting there. We've done a lot, and repealing the statute of limitations on sexual assaults of children over the last few years, that's been a big thing. So now, if you have a test kit that's quite old, we still might be able to put together a case. Nothing else? You seem to know more than anybody. That's good. All right.
Well, thank you all. I appreciate
Thank
you
you.
being here, and we'll be around if anyone has questions in the meantime. But thanks for coming.
Thank you. Thank you, Senator. Thank you, Representative.